So firstly, we're going to discuss about emergency room settings. So ER is high-paced, intensive healthcare environment where patient come with urgent or any life-threatening condition. So there should be proper teamwork between the healthcare providers, critical thinking, and fast-paced decision making. After that, the importance of technologies which are used in ER. Firstly, it helps to improve the communication. It encourages the healthcare provider to follow proper triage and improve outcome in a positive manner and give us real-time data access. So we have some of the objectives for our presentation. Firstly, we're going to discuss about triage and patient tracking systems, key technologies which are used in ER, EHR and data integration, telemedicine, remote monitoring, and AI in ER, benefits and the challenges of the technology, ethical consideration, and conclusion and future directions. After that, we have triage and patient tracking systems. Firstly, in this, there is a digital triage tool which helps to prioritize the patient according to their severity and reduce the human error, which eventually leads to the patient safety. After that, there is improved prioritization and patient flow, which helps to reduce the waiting time of the patients who really needs care at the urgent level and follow the triage process smoothly and helps to make the decisions quickly. So after that, there is patient tracking system which helps the healthcare provider to get the current location of the patient and real-time status of the patient. And there is an example from a hospital in New York. In that hospital, they implement the digital triage system, which helps them to reduce the waiting time for the patient up to 20% because they follow the triage process and prioritize their patient accordingly.
Myself Prabhjot Singh, and today I will explain about the diagnostic and imaging technologies that we use in emergency room. Well, there are many tools that we can use, like first of all is point of care ultrasound. Well, point of care ultrasound is different from normal one, that this device we can use in near the patient bedside in the presence of physician, which will be helpful toward the wastage of time. And next one are CT scan. So CT scan is the overall detailed imaging of the internal organs, which will be beneficial to diagnose any tumor and internal bleeding. And next one is portable x-ray. So portable x-ray can be transferred from one place to another, so it will be beneficial to avoid wastage of time, and it provide more accurate images than normal one. So these tools support rapid diagnosis and treatment. So first point is speed and accuracy. So speed and accuracy means they very good technology, so that's why it will be helpful for the physician to early diagnose by seeing the images. Next one is at the point of care. At the point of care means it can be used at the patient bedside, so it will be beneficial. Next is real time decision without wait. Well, next one is timely intervention in critical conditions, so it will avoid wastage of time. And finally, so improve patient outcomes is the as early as the physician made diagnosis, it will be helpful for patient to improve in health condition and health outcome. Thank you.
Uses of electronic health records in the emergency room. Number 1. Real-time documentation. Nurses use EHR to immediately chart patient symptoms and treatment plans during an emergency visit, ensuring up-to-date records. Number 2. Quick access to patient history. A patient comes into the ER unconscious. The nurse quickly reviews their medical history, including allergies and chronic conditions, in the EHR to prevent adverse reactions. Number 3. Streamlined communication. Doctors and nurses use shared notes within the EHR to coordinate patient care continuity of treatment. Number 4. Enhanced decision support. The EHR system flags potential drug interactions when a nurse inputs a new prescription order, preventing errors. Integration with other systems for seamless care. Number 1. Interface with lab and imaging systems. A patient's blood test results are sent directly to the EHR from the lab, allowing nurses to access results without manual entry or waiting for paper copies. Number 2. Connection with pharmacy system. When a doctor prescribes a medication, it is automatically sent to the pharmacy system, enabling nurses to promptly administer the right dosage. Number 3, integration with patient monitoring devices. Vital signs from heart rate monitors and blood pressure devices are automatically updated in the EHR, saving nurses from manual data entry. Number 4, coordination with primary care systems. After an ER visit, discharge summaries are sent to the patient's primary care physician, ensuring follow-up care is informed by their ER visit details. Benefits for nurses using EHR in the emergency department. Number 1, increased efficiency. Nurses spend less time documenting on paper and more time attending to patient care because EHRs streamline the documentation process. Number 2, improve accuracy. With digital charting and standardized templates, the risk of handwriting errors is eliminated, ensuring the patient data is clear and correct. Number 3, faster access. Nurses can pull up diagnostic images, lab results, and patient histories instantly, making decisions quicker in critical situations. And number 4, enhanced communication. Integrated EHR systems allow nurses to easily share notes with other departments, ensuring everyone involved in the patient's care is informed and aligned.
Coming up with telemedicine and remote monitoring in the ER, as we all know, ER means emergency room. So in the emergency room, telemedicine has become an important tool that allows doctors to consult with specialists remotely. This is especially helpful in areas where specialists are not readily available. Let's take an example of neurologist. So neurologists can remotely help diagnose and treat patients with strokes in the crucial moments when every second counts. Telemedicine makes it possible for patients to receive expert care without waiting for a specialist to arrive physically. Next is remote monitoring also helps by keeping track of patients' vital signs like heart rate or oxygen levels in real time. This is useful for patients who may not need immediate intensive care but still need close monitoring. For instance, a patient in the waiting room can be monitored remotely to make sure their condition doesn't worsen. These technologies bring many benefits. They help nurses manage their workload more efficiently and allow patients to receive fast care, which is especially important in ER. However, there are some challenges, as we all know, like in every field, such as the need for a reliable internet connection and training for staff to use these technologies effectively. There are also concerns about patient privacy and the security of their data. Now, the next part, DSS and AI. DSS means Decision Support Systems and Artificial Intelligence, as we all know, in the ER, emergency room. So decision support system and artificial intelligence are becoming more common to help doctors and nurses make quick and accurate decisions. DSS are software programs that give real-time suggestions based on the latest medical guidelines. For example, a DSS might suggest the best treatment for a patient with sepsis or alert nurses about potential drug interactions, helping prevent mistakes. AI takes things further by analyzing a patient's data, like vital signs and lab results, to predict what might happen next. For example, it can support early signs of serious conditions like sepsis or cardiac problems, alerting the medical team before the situation gets worse. AI can also help prioritize which patients need attention first based on their symptoms and risk levels. These technologies are beneficial because they reduce the mental strain on nurses and doctors, allowing them to focus more on patient care. Patients benefit from faster, more accurate treatment, and the ER becomes more efficient overall. However, there are challenges. These systems aren't perfect and make mistakes, so relying on them too much can be risky. Implementing them also requires a significant investment in technology and training. Additionally, there are concerns about transparency and privacy when using AI and DSS in patient care.
Hello everyone, my name is Divjot Singh and my topic of discussion for today is benefits of technology in the ER. So my first topic of discussion would be improved patient monitoring. So if we talk about improved patient monitoring, the use of technology cannot be ignored because we have devices such as Holter monitor which help to increase the frequency of diagnosing of any abnormal ECG, and it is a good example where technology is employed to improve patient monitoring. The second topic is enhanced communication. By the use of cell phones or any other mass media, we ensure that the members of a healthcare team are communicating properly and there is enough teamwork among them so as to improve patient health outcomes. The next topic is accurate documentation. So as for accurate documentation, we nowadays have electronic documentation facilities such as softwares of PCC, which stand for point click care, in which documentation is done on electrically, and there is a proof that the things have been there is a proof and accountability has been established. The next topic is faster diagnostics. So as for the diagnostic, we have certain big machines which are like CT scans or rapid antigen testing for communicable diseases, which help us to diagnose a disease early and make sure that the treatment is begun on time. The next topic is medication safety. So as for the medication safety, when we use technology in this field, it is to be done. It is to be made sure that the dispensing of medication, the administration, and the delivery of medicine is to be done on time, making sure 10 rights of medication are to be followed, hence ensuring medication safety. The last but not the least topic is improve triage efficiency. So as for the triage, we classify patients on their physiological needs, and when technology is employed in the field of triage, there are certain algorithms used by certain softwares which helps the healthcare worker to classify patients on their physiological needs, and patients' emergencies are met on time. Thank you.
Now, let's discuss the challenges in the ER technology implementation. So, the first challenge is system downtime and server failures. The unexpected outages have the potential to delay patient care, cause errors, and risk the lives of the patient due to the delayed communication, and disrupt the operational efficiency, making reliable technology essential. The second one is staff training and adaptation. We need to ensure that every staff member of the interprofessional team are proficient in utilizing new technologies, and also after training we need to ensure that the work is not slowed down because the training would slow down the work as they are in the learning phase. So this process can be time intensive and financially burdensome. The third challenge is high costs. The initial financial investment and the ongoing expenses for maintenance are considerable, necessitating careful budget management as some departments would be underfunded. The fourth challenge is integration with existing systems. It is imperative for new technology to integrate seamlessly with existing systems. This integration often presents significant challenges. As we can take the example, like the older EHR system can't be integrated seamlessly with other departments who have their existing systems of the EHR. The fifth challenge is data privacy and security risks. The protecting sensitive patient information is very crucial to prevent breaches and to ensure compliance with the regulatory standards. We need to maintain the confidentiality of the patient by ensuring the security standards of the HIPAA.
So, what are the ethical considerations in technology use? The first one is privacy concern. In privacy concern, patient data is often digitized through technologies like electronic health records. This raises issue about the security of sensitive information. The first and most important is the privacy and confidentiality of the patient, which is the first concern. And the next one is equitable access. Like, not all healthcare facilities have equal access to advanced technology, especially in rural or unreserved area. So it can be not the equally distributed to the rural area or the other areas where these technologies are not in use till now. Next one is the ethical dilemma. Over reliance on technology might lead to diminished human judgment, potentially overlooking patient specific nuances. So this one is the ethical dilemmas for the technology use. Human oversight. Ethical standards demand maintaining human oversight, especially for life and death decisions, to avoid errors caused software malfunctions or misinterpretation. The last one is informed consent. Patients should be informed about how their data will be used and stored, and who will be using their data and who will be stored their data.
In a nutshell, technology can shape the future of emergency room care by enhanced patient triage. AI-powered tools can prioritize patient care based on real-time data analysis, improving response time. Predictive analytics. Data analytics can forecast patient surge and resource needs, enabling better preparedness. Telemedicine integration. Virtual consultations can expand access to specialists, aiding in quicker decision-making. Improved workflow automation. Automated documentation and order entry can reduce administrative tasks, giving nurses more time for patient care. And lastly, advanced decision support. Machine learning algorithms can assist with diagnostic, suggesting treatment opinions and flagging critical conditions.